Implementation of a quality improvement project for medical reconciliation outcomes in a primary care residency clinic. The US FDA receives more than 100,000 reports each year associated with a suspected medication error, and each year in the United States alone, 7,000 to 9,000 people die as a result of a medication error. Medication reconciliation, or MedRec, is a process of creating the most accurate list possible of all medications a patient is taking, including drug name, dosage, frequency, and route, and comparing that list against the physician's admission, transfer, and/or discharge orders. The purpose of our QI project is to increase resident, patient, and clinic staff awareness of MedRec. We aim to increase compliance of MedRec from 62% in August 2020 to above 80% in December 2020. Our aim is also to maintain MedRec above 80% from January 2021 to March 2021. Our QI project included 12 internal medicine residents, which all had different tasks in our project. In development of this QI project design, we saw room for improvement within multiple facets of our outpatient clinic, including people, materials, environment, methods, and equipment outlined in our cause-and-effect diagram. Our interventions to address these issues including sending text messages to residents reminding them to complete their patient's MedRec and reminding patients to bring all of their medications to their appointments. We address this issue by posting flyers in our clinic as reminders for residents to complete MedRec. We also added a checklist reminder directly on the patient's face sheet as a reminder to residents to place orders, referrals, and to complete MedRec before the patient left the clinic. Our clinic cohort observed the medication reconciliation done in our outpatient internal medicine clinic from the month of August 2020 to August 2021. We observed that prior to our interventions, our outpatient medication reconciliation was lower than 80%, and in the month of August 2020, our percentage of MedRec was 62%, improved slightly and gradually to 65% during the month of September, then to 74% in October 2021. However, following the start of our intervention in November 2020, we observed a significant improvement in MedRec. During this month, the compliance increased 8% from 74% to 82%, and this trend continues. In December 2020, it increased 90%, and during the months of January, it decreased slightly to 88%, and in the month of February, March, and April 2021, medication reconciliation plateaued in 87% and 85% respectively. Overall, our medication reconciliation has improved. We noted that there is a difference between residency classes. Residents in their first year perform MedRec more frequently than residents in their second or third year. And there are some limitations to our project, such as systematic errors that we found in the monthly reports that might not truly reflect the lack of MedRec. Another limitation in our monthly report is that MedRec performed before or after the date of service were reported as partial MedRec. Overall, our quality improvement project increased resident and clinic staff awareness of medication reconciliation. We were able to maintain MedRec above 80% from January 2021 to March 2021. In addition, we were able to identify possible barriers in the process that were not recognized before, including issues related with equipment, workflow, and environment. Moreover, our intervention allowed for accountability because residents were monthly informed about their own performance compared with the rest of resident physicians. This is especially important because our initiative allowed for development and self-improvement during training, which ultimately might result in less medical errors.